Do you have a yeast infection? There are some symptoms that might help you recognise it. Number 1, you might notice thick, white, odour-free discharge that may be clumpy. Number 2, soreness and stinging when you pee. Number 3, itching, burning and soreness in and around the vagina. Number 4, redness and swelling of the vulva. Number 5, pain during sex.
Is your discharge normal? Let's chat. If your discharge is clear or white, this is typically a sign everything is working well. The vagina should always have some secretions, and changes in texture and colour can be caused by hormonal fluctuations throughout your cycle. However, if it's white and lumpy, like cottage cheese, it could be a sign of a yeast infection. What about yellow discharge? If there's a slight yellowness without any other symptoms, this usually isn't a cause for concern. In fact, white vaginal discharge often appears more yellowish when it dries, especially when compared to white underwear or a panty liner. But if there's a stronger hue, it's excessive, or you have other symptoms, it could be a sign of an infection. It's important to know that yellow discharge can also be a sign of an STI. Brown discharge isn't necessarily a problem. Some people have brown discharge every menstrual cycle. It tends to happen when your period is winding down or just starting. You may also notice it if you have lighter periods or use birth control that gives you a lighter flow. However, if it's happening at times other than your period or it isn't your norm, it's important to take note. It can be a sign of a hormonal problem or infection. There's a good chance there's nothing to worry about when you're seeing pink discharge. Normally, it's just a little blood mixed in with your normal discharge. You might notice this at the beginning or end of your period, and if you start hormonal birth control. Ovulation can also trigger light spotting around the midpoint of your cycle. However, it can also be a sign of a medical problem, like an infection or fibroids. Grey discharge might be a problem. It can be a sign of bacterial vaginosis, which is caused by a change in the natural balance of bacteria in your vagina. It can be accompanied by a strong, fishy smell. It could also be a sign of a sexually transmitted infection. The good news is that both of these are treatable. The best bet would be to get checked out by your healthcare provider. Green discharge is most often a sign of infection. It can be a sign of an STI or bacterial vaginosis. If you have green discharge, especially if other symptoms accompany it, it's best to speak to a healthcare provider to get checked out. Remember, if you're experiencing discharge that's not normal for you, more discharge than usual, or you have other symptoms like itching or pain, fever or unusual bleeding, or you don't feel well, talk to your healthcare provider.